years since COVID-19 was detected in the tri-state, with the first case in Henderson.
Since then to now, we've had to change the ways of life that we've always known. But how did doctors, nurses, and others in the medical field change their care?
Well, joining us this morning is Dr. Phillip with Deaconess. Good morning, doctor.
Good morning.
So the first question we have for you is, when you first heard of a new unnamed virus was spreading across the globe, what were your thoughts?
Sure. We first started thinking and started wondering, what would happen with it, just like everyone else did. Initially, all the thoughts pointed to that hopefully it would be contained like some of the other viruses that we've seen, like Ebola. But unfortunately, it continued to progress and spread. And so, we just kept having to adjust and learn more and more about it.
How did Deaconess make changes for a virus we knew so little about at the time? Obviously, we've grown to know more. So how have things changed from March of 2020 to now March of 2022?
There have been a tremendous number of changes, just like everyone else has experienced. We were very fortunate to kind of be ahead of the curve on a lot of the work around COVID-19. We got some of the early equipment. We were one of the first ones in the state to be able to even test for COVID. We started doing a lot more virtual visits. We were able to establish those very quickly. We changed our way around the way that we were able to get patients access to testing. We started drive-through testing. We've done a tremendous number of things in order to help improve access and make sure patients can still get the care that they need.
And so now, over the past 2 years, what has Deaconess done to kind of change your tactics on how to respond to a virus outbreak? What has changed, Dr. Adams?
Sure. I think the readiness factor of that has changed considerably. We learned very quickly that we could form a very strong team that can meet these different needs. And we were able to utilize people all across our organization in functionality that they hadn't done before. And it was kind of an all-hands-on-deck approach, so people were helping in many ways. I think early on we saw a video from one of the vice presidents about how to make a mask that went viral. We had managers that were cleaning rooms. We had staff that were volunteering and working on weekends to help cover clinics, the drive-through clinics. So, I think that what we've learned is that we have the ability to rapidly adapt through these difficult changes. And so I think that's been a very valuable lesson for all of us.
And knowing what you've learned and what all has been learned at Deaconess over the past 2 years or so, do you see a new world in how our health systems will operate?
Yeah, absolutely. I think we've seen that in our personal lives as well. I mean, who would have thought 3 years ago that, we would be going to a store and going and get curbside pickup? I think the same is true for healthcare. We're seeing more drive-through clinics for immunizations, for testing. We're seeing more and more virtual visits, more ways to connect with patients with their providers. So I think you're seeing all of that. You see more home-driven tests, like the COVID rapid test at home. I think we're going to continue to see more of those types of opportunities for patients and more access in general.
And of course, we've all been affected in some way. Lots of hardships, not seeing friends, not seeing families, social distancing from each other. From a medical perspective, from doctors and nurses and all the staff there at Deaconess, what was really hard during really kind of the heights of the pandemic?
Sure. We shared all of those same frustrations and same challenges. When it was incredibly busy, a lot of long hours for a lot of our providers and our staff, picking up extra shifts, covering extra people that would happen to be sick. Obviously it's been difficult on all of our employees and their families as well, doing our best to keep everyone that we know and love safe.
And in terms of vaccines, you think people will need boosters every 6 months to a year, kind of like a flu shot from here on out?
That's certainly a possibility. I think that's still to be determined. We're still learning a lot about, what kind of a response people have to the different immunizations. But I think likely that we will need that in the short term at least. But it's hard to really predict kind of where that's going to end up being.
Well, Dr. Adams, thanks so much for your time. And as always, we said hopefully 2021 will be better. Now we're looking forward to 2022, and hopefully it will be better. So hope all is well with you, with your friends and family there at Deaconess, and thanks so much for your time this morning.
Thank you.